Yeah, thank you very much for this very intellectually stimulating discussion. I had a couple of observations. One is there's a breaking news that the City Council of Berkeley endorsed the Healthcare Freedom Act. That was just April Fool. Anyway, I'm originally from India. I am a physician. I came here, got my MD, PhD. I'm currently working in a forensic hospital. So it's a different type of practice compared to the concierge kind of practice. Couple of thoughts about when you mentioned California and the possibilities there. What I've observed is over time, a majority of the colleagues I work with endorse socialized medicine. So I think the greatest threat for freedom in medicine comes from within. It's, if you're familiar with Ayn Rand's literature, these are the Orrin Boyles who want socialized metallurgical sciences, or these are the Peter Keatings who want socialized architecture. So to address that, the phenomenon I'm talking about is this drift of physicians from private sector into public sector. Now, typically the public sector physicians get paid more, artificially more, which is the nature of socialized medicine, artificially more than what they would get in a free market. Now, a certain percentage of their income, whether they want it or not, is paid as the union dues or fair share. Now, typically with these overspilling coffers, the unions are able to sponsor politicians who are going to, again, promote socialized medicine. So somehow we need to move towards the right to work state so that this unholy nexus can be broken and we can have more freedom among our politicians, which brings me to the second point, that we do have politicians of high moral caliber, and I wonder how many of us take notice of that and make it a point to provide them the moral support that they require. Recently, Rand Paul made a statement equating socialized medicine to slavery. Now, granted, in the liberal media, he's going to be pilloried for it, but the comparison is really apt. And my question to AFCM or AAPS is, as an organization, do you take a stand? Now, as a private citizen, I sent him an email. It's very easy in today's day and age to send out an email, locate the contact address, etc. Do you make a statement saying, we endorse your viewpoint, keep it up, or I would encourage people here to, at the end of the day, maybe at least send half a dozen emails from here to support him. Thank you.
Thank you. So, yeah, I don't know if you've seen our flyer, Healthcare is Not a Right. We certainly do try to support with intellectual material, that position. But with respect to addressing the candidates, it's one of the things I was saying. We're going to create a plan, and we're going to contact those people that we think would be consistent with our principles so they can support it and get it out there. But I think it's also an excellent point just to the audience in general that we do have to be active a little bit and support people that do present the ideas we agree with.
Yeah, I just mentioned from the AAPS standpoint, if you go to the AAPSonline.org website, that's our homepage, you'll see Rand Paul is on there on a YouTube talking to the press about our lawsuit last year. Rand Paul is a member of AAPS, and his positions are consistent with a lot of the positions at AAPS. Have no problem supporting what Rand Paul says.
I'd like to also say that I agree. A big problem I notice, because I'm out there in the trenches with everybody else here, a lot of the young doctors, they think Obamacare is great. They think socialized medicine is great. They're all for single payer. It's a real problem, I think, because a lot of these young guys coming up, they're all products of our public education system, which is, when I went to public school, which I did, it was a lot different than it is today. Like Yaron Brook was saying earlier, they're all kind of got this sort of philosophical, these philosophical principles inculcated in them, and I think it's a real problem. I see a real schism in the doctor's dining room, lunchtime. You got those who are about 40 and up are really angry, and those who are 40 and lower are all bewildered as to why we're so angry.
But I would just add that the AAPP, the American Academy of Private Physicians, we're concierge doctors, but obviously we do more than make reservations. We are the fastest growing mode of practice in the country. So more doctors are switching from the old into the opportunity to practice our way, if you will, and work for their patients. So it is converting because doctors are just sick and tired of being sick and tired. And I would also mention that get involved in the Benjamin Rush Society.
That's what I was gonna say.
You know, I've participated in those debates, and you know, we win the audience over. I was just at the American Academy of Medical Students, and you can't believe how many of these students are, thank God you're there. They really want the opportunity. They thought that they were going to be stuck in a 9-to-5 job, you know, basically working for the government. So if we continue to have the discussion and get out there with the discussion, people who are professionals will absolutely convert over to the opportunity because they see the opportunity as maintaining their professionalism. But we can't sit in the closet. We have to get out there and talk about it.
So for those who didn't catch it, the Benjamin Rush Society is the society that educates medical students, and they have clubs in the medical schools, which is a great thing that's getting started up. I think they have 15 or 20 medical schools now.
Right.
And that's, you know, like I was going to say, where there's several, you've been exposed to several organizations here, and you might say, gee, which one should I support? And the answer is all of them, because we're doing different things. But that's,
there's also
that
one
helps
more
address that point.
organization. It's the Physicians Council for Responsible Reform, this PCRR. It's relatively inexpensive to join. I think it's like $100, and they really work right with the Doctors Caucus. There are 18 physicians, Republican physicians in Congress, and we meet with them personally. I meet with them all the time, and I'm constantly talking to them personally. We have legislation that is sitting there to be discussed. Tom Price of Georgia just submitted H.R. 1700, and it's our right and our patients' rights to privately contract. So if you have any questions, I'll have my cards here. You can contact me. I'll give you all of these addresses, and you can go to these sites and you can show those congressmen that this is what you want. And of course, you got to go tell your friends, and you got to go tell your clubs, and you got to go to your churches, and you got to go to your synagogues, and you got to go everywhere and tell everyone else the same thing.
Yeah. Next question.
Hi. I'm Dr. Felice Gersh. I'm also one of the dying breed of private practice physicians, and I wish that weren't so, but it does seem that way. And I have two quick questions. And one is, I go to medical conferences all around the country, and most of the doctors I speak to in other states are now employed by hospitals. And hospitals used to be our, you know, sort of our friends, but now I look at them as tremendous adversaries and in what they're planning and what they're doing. And here in Orange County, there's a lot going on with the doctors and the hospitals, with foundations that are being created and taking over doctors' practices. I think over half the doctors nationwide are now employed by hospitals. So my first question is to just address that issue. And the second one was a clarification issue for Dr. Z. One of the earlier questions stated that with the new Obama plan, that your type of practice where you contract directly with patients who otherwise would be in Medicare, that would be illegal. And I just wanted to confirm whether or not that really would be the case. Thanks.
You know, the answer with respect to hospitals, I mean, an approach to the answer is, again, if we convert to more of a non-employer-based insurance system, such that people have their own dollars and they buy insurance in medical care like they would in any other field of their life, so like a high deductible, they won't accept going to a hospital and not knowing what it's going to cost. And it's just, I mean, the differences between hospital charging and outpatient surgery charging and other charging is so phenomenally different. That would change very quickly. And basically, it's one of those things where, you know, it's one of these symptoms. There are so many compounding symptoms that occur, and you can't figure out how the market will untangle them. You have to get more at a deeper root, and that's where the concepts we talked about will be successful. And fundamentally, when people have their own money and they're shopping for it, and you have rational insurance that they're buying, they will go to places that will give them value. And if the hospital isn't it, and if the hospital hiring doctors isn't it, they're not going to go there. And other types of care are going to open up. The private care sectors, private care sector doctors getting together, rebuilding hospitals the way hospitals used to be built, if in fact that's a better model for what people want. So I can't figure out all the consequences and all the symptoms and try to untangle them from the top, because that's what we're doing. That's the problem we're running into. A law to do this, or restrict a hospital from do this. Or, you know, we have to attack it from underneath and recognize that when you have the fundamental principles working well, those things will adjust as long as we get government force out of the way. And you allow, obviously, adjudication of real fraud. I mean, if hospitals are committing fraud, then, yes, we have to deal with that. So, and as far as the mentality issue, I guess we dealt with that already with the education.
Right. In answer to your question, actually, we are part of the Obamacare law. Our lobbyists have managed to make it not only legal, but to allow our patients, if Obamacare continues, and if it does, it is law, but if it continues and the regulations are left in place, there is a regulation that says that a patient who buys my care may deduct the amount of money they've spent on me from the cost of their health insurance, so that our patients will actually pay less for their care. How did this come to pass? Because we actually have shown the government the truth. We cost less. If a doctor and a patient have a relationship, the total cost of care is less than through the insurance industry. In every mode of practice, whether it's insurance, Medi-Cal, or Medicare, our patients don't go to emergency rooms. They don't necessarily get redundant medications. We actually know what's going on, and their overall cost out of pocket, the insurance cost and the Medicare cost, is less than in traditional medicine. Our patients see an average of 2 consultants a year. Traditional Medicare patients see an average of 12 consultants a year. So we went to the government with the data, and we not only got ourselves heard, but we got ourselves put into the legislation to protect our patients so that they will have the right to choose. One last thing with response to the ACO. First of all, the fact that the Geisinger Clinic and the Mayo Clinic have come out against ACOs, and I don't know if you've read the 429 pages, but it is impossible to play the ACO game. It is absolutely impossible. It is economically unfeasible, and people are now starting to talk about it. In fact, our hospital and the tenant hospitals are not going to play either. So unfortunately, what has happened, a lot of doctors got a little bit scared, and of course they went to their hospitals to find cover. Hopefully they'll uncover and go back into private medicine. But in the meantime, there are opportunities that you should know about. And one of the things that we're involved in private medicine is international opportunities. The sad truth is, and I didn't mention it, but I think we all know, that the United States is not on top of their game anymore. We are not the best in the world. And I am traveling the world. I've been to Turkey and Brazil this year, and I've talked to the best of the best. I've seen their hospital systems, and guess what? They work better. Their hospital bedrooms are single bedrooms. Every patient knows what the cost of that hospital bed is, and so do the people who engage in their care. Patients can actually go online and buy care in Turkey, Indonesia, China, Thailand, Singapore, Malaysia, Brazil. And guess what? It's less expensive. It's delivered by physicians who have at least our expertise, and the patient knows what it costs, and they don't get nickeled and dimed with crazy EOBs for 10 years after their surgery. They don't have a heart attack after they get their bills. And when patients are awarded the opportunity of choice, guess what? They go. Billions of dollars, not millions, not hundreds, not thousands, billions of dollars are now being spent in medical tourism, and patients are leaving our country. So you're right, Art. Patients will not choose the hospital down the street that's dirty, that has double bedrooms, and where the first thing they say is, what is your insurance and how quickly can you get out of here? But they will go to a place where it's serviced. The hospital looks like a Four Seasons hotel. The service is wonderful, the food is excellent, and they know what the cost is beforehand. And guess what? That's patient choice.
Thank you, Marcy. Yes, Jeff?
All right. Amongst the credentials I spoke about earlier, I'm also a concierge rheumatologist, and I run a solo practice, and I run it on a concierge basis. I have very special patients, and they really do understand what the healthcare system is like, and they understand what cost efficiency is all about when they do get that kind of service. And there's no question, Marcy, that in my practice, I have saved the healthcare system tons of dollars and have had my patients have a better life for that. So you're absolutely correct. I can tell you that on the basis of my experience. However, I think we do have a problem. You have special patients, I have special patients. They get it. The majority of the country, unfortunately, does not get it. And the big problem here is that everything we've talked about, we all get it here. But how do we articulate that to the community out there at large? And I think that's really the big problem, because the community out there is scared, and this entire crisis that really doesn't exist is not a crisis, it's an evolution of a system that has gradually gotten, it has followed the course that it would have anyway. It's not a crisis. There is a problem, there's no question, but it's not a crisis. But people believe it's a crisis. So in order to articulate what the issue is becomes the critical thing. We're smart here. We can run through lists. We can go through, change the tax code. We need to have insurance across state lines. We need HSAs. We can articulate that. Patients don't understand that. People don't understand that for the most part.
But that has to change.
No, I'm not disagreeing.
So I don't know. Okay. The point is that, you know, we know. So what we need to do, and that's why, and I probably need to close.
What I'm saying is, our articulation of this doesn't resonate with the community. People don't get it because we don't go to.
Hold on a second. How many here got it? What we're talking about?
But this is a special group.
I understand.
This is a motivated group. It's telling people.
Jeff, can you get to your point, because we have 1 minute left?
Okay. The point is, and I don't want to be argumentative because I don't disagree with you. I'm just saying that we can do this forever, and it's not going to change a thing. If we don't have an effective way of telling people that it's not about the money, it is in the end, but it's not about the money, it's about their well-being, and they don't get that. So when you talk about something like, and I agree with you, that employees should give the money that they spend to their employee, that employers should give their money to the employees. However, what the employers are doing right now is the greatest con game in the world. What they're doing is they're reducing the payments gradually and slowly for health services so that by the time, even if that came to pass, the amount of dollars that are going to be available are substantially less than when we started talking about it, because they're gaming the system. And that's what people are afraid of. So we need to articulate much better that we have control of the system, that patients have control of the system, and that people that understand how to game the system aren't going to rip them off. And that, I think, is one of the big fears. And that's why we're not making, I think, the headway we should, because we don't come up with a better message that protects them.
Okay. So I guess my recommendation would be, if you have a way to say that, then we would love you to join us and produce that material, and we can distribute it through our ambassador program. Because the only way, I mean, we can complain, we have no way to do it, but the only way then is to brainstorm, to take the ideas and figure out how to package them. I mean, if we had the dollars, you know, when the Clinton Health Plan existed, they're all complicated issues, but the insurance industry had enough money to come together and have those, what was it, Harry and James, or the two couple, and they did a few commercials, and they actually communicated the message pretty well. So there are people smarter than me in, I just can't afford to pay them myself yet. So the point is, we have to get the people that we can communicate with the best way we can. This was the way I felt we could do it today. And if you want to participate with us, I'd love you to start administering stuff through your office and producing materials you think communicate better to your patients. You might find a patient that's a marketer who can understand these ideas in a couple hours and say, boy, I can put a 30-second commercial together to get these ideas about. And then that person can raise money and put on TV. I don't know the exact path. The point is, I know the right problem and I know the solution.
Art, I think what Jeff is saying, and you would agree, that it's about our patients. So we need to change the conversation. It needs to be about the patients. That's what they'll listen to. And that's pretty much what you're saying too. But what we need to do is we need to make sure that we allow them the opportunity to invest in their health. And we need to somehow communicate that. You're right. We got to get to the people. And it's fascinating to me. You know, the legislators are still talking about revamping SGR. When I went to them and I said, forget SGR. I don't want to work for the government, and it doesn't matter what damn formula they put together. It doesn't work. I want the money in my patients' hands. It's their right. It's their choice. And they said, oh, are there other doctors that feel that way? And I went, whoa, don't you think the nation feels that way, that every patient feels that way?
Actually, Marcy, I think maybe from in terms of messaging, what we learned is about freedom.
Right, and choice, and
But
it's theirs.
we actually, like I say, originally, our first time out of the box, we used choice because we thought that was going to resonate better with the public than freedom. Second time out of the box, we used freedom, and people got it. So that's, I think, that if you're going to use a word, it's got to be
And that kind of messaging does this to get up. But in the end, I think what we're all saying here is that it's got to be centered around the patient, because our patients are the voters, and it's about them, and that's why we get up in the morning in the first place, because we're all about the patient too. So somehow we have to get that communication out, and we need to do it on every TV station and every newspaper, and it has to be the patient's conversation. And once it becomes their conversation, then the legislators will start to listen. And even California may get it.
I forgot to mention one thing. A lot of people have seen this handout about the U.S. Health Freedom Coalition. That's a C4 organization that we started that promotes healthcare freedom acts around the country. So if anybody's interested in helping the Healthcare Freedom Act movement, you can go to that website.
Yeah, particularly if you know someone that doesn't live in California.
Yeah, that's especially Californians can help.
All right.
Go to ushealthfreedomcoalition.com.
So on the education note is, I mean, basically it's an educational process. Different angles get through to different people. It's a marketing issue. What I want to try and do is create foot soldiers to help us promote this. So please sign up, and then we'll have one last question, and we'll be over.
Thank you very much. Very interesting, to say the least. I wonder if you could tell me of your organizations. Are you 501c3, 4, PACs, or all?
Okay. AFCM is a 501c3 educational foundation. So we're taking the ideas. Ultimately, it's other organizations that are turned into legislation.
501c6.
I think we're a 3. Jeremy? 6. Okay, and we also have a PAC.
And the U.S. Health Freedom Coalition is a 501c4.
And thank you all.
I want to thank everyone for coming. You've had a real endurance. I appreciate it.